Hello, my name's Chris Letheby. I'm a lecturer in philosophy at the University of Western Australia and a postdoctoral researcher at the University of Adelaide. My main area of research is the use of psychedelic drugs in neuroscience and psychiatry. So in this short video, I'm going to talk about how the concept of epistemic innocence introduced by Lisa Bortolotti can help us think about the states of consciousness that are induced by psychedelic drugs. So in her monograph, The Epistemic Innocence of Irrational Beliefs, Lisa Bortolotti urges us to re-evaluate the epistemic status of certain beliefs that are standardly defined as irrational. Among these are clinical delusions, confabulations, and beliefs that are based on implicit bias. Now, it's not a new idea that irrational beliefs of this kind might actually have benefits of some kind, specifically pragmatic benefits or benefits for psychosocial functioning. On what Lisa calls the standard trade-off view of these kinds of beliefs, those kinds of benefits are simply purchased with epistemic costs. So the trade-off view is encapsulated by the phrase, ignorance is bliss. So you might get some sort of benefits from having irrational beliefs, but those benefits are purely pragmatic, and from an epistemic standpoint, these irrational beliefs are solely bad news. Now, Lisa's point, the main contention, both of the book and of the broader Epistemic Innocence project, is that this trade-off view is overly simplistic because it relies on the idea that irrational beliefs of this kind have only epistemic flaws and are totally devoid of epistemic benefits. And this idea is precisely what she wants to challenge. So she argues that in addition to their obvious, undeniable epistemic costs, irrational beliefs, like clinical delusions, can sometimes have significant, non-trivial epistemic benefits as well. Now, how would this work? Well, often it actually goes via their pragmatic or psychosocial benefits. So when we think about the sorts of delusions that have been called defensive delusions or motivated delusions on the grounds that they might actually play a psychological role, a defensive role of kind of shielding the patient from catastrophic despair or psychological collapse, Lisa points out that, look, if that's true, if defensive delusions really do shield against catastrophic psychological collapse, then that's going to have epistemic benefits as well, because psychosocial functionality and epistemic functionality in humans are profoundly intertwined. They can't be neatly separated. One of the main ways that we as humans, as social creatures, gain knowledge about the world is by exploring the world, engaging in it, engaging with our peers, subjecting our beliefs to scrutiny, and so on. So to the extent that a motivated or defensive delusion does preserve psychosocial functionality, yes, it's going to have epistemic costs. It's going to prevent us from being in touch with the truth or the reality of our situation, but it's simultaneously going to have this non-trivial epistemic benefit that it actually preserves a level of psychosocial functionality where we're in a position to keep gaining knowledge about all sorts of other topics besides the theme of the delusion. Now, in the monograph, The Epistemic Innocence of Irrational Beliefs, the concept of epistemic innocence is defined specifically in terms of beliefs, but the basic idea generalizes. It can be applied to other types of cognitive states or processes. And in my work, I've applied the idea of epistemic innocence to certain highly controversial states of consciousness. And I'm talking, of course, about psychedelic states. So in other words, altered states of consciousness induced by psychedelic drugs, such as LSD and psilocybin. Now, psychedelics like LSD and psilocybin were the subject of a lot of scientific research in the 1950s and 60s. Since the 1990s, this research has been resuming and it's really gathered pace in the last decade or two. And so far, the findings are quite intriguing. So first and most importantly, contrary to received wisdom, it turns out that it is possible to give moderate to high doses of psychedelics safely to human volunteers in highly controlled conditions if certain stringent safety guidelines are followed. And when this is done, subjects report altered perceptions, intense emotional experiences, insights into their lives, and states of self-transcendence, including so-called mystical experiences of union with the cosmos or the divine. And virtually all subjects rate their experiences under psychedelics as highly valued and highly meaningful. In some cases, they rate them as among the most personally meaningful and significant events of their lives. So this is quite remarkable. Most interestingly of all, perhaps, some clinical trials suggest that psychedelics might actually have therapeutic benefits that appear to go via their effects on consciousness. So there are several studies that look at what happens when you administer 1 or 2 moderate to high doses of psychedelics to patients with symptoms of anxiety, depression, and addiction. And in particular, some of these studies look at existential distress in people with a terminal diagnosis. And across virtually all of these studies is quite a consistent finding. 1 or 2 supervised sessions in a psychotherapeutic context can lead to reductions in symptoms that are quite substantial and that last for many months, sometimes even for years after just 1 or 2 sessions. So this is quite a startling, and if these findings are replicated, this could be quite a big deal in psychiatry and in the treatment of mental illness. Now, the concept of epistemic innocence becomes relevant because there's a real question about the epistemic status of these apparently beneficial states of consciousness. So across several of these studies, the strongest predictor of positive clinical outcomes is having, while under the influence, a mystical type experience, an experience of cosmic consciousness or of union with ultimate reality or a divine reality. And so the finding that this sort of experience specifically seems to be what's mediating the positive effects is quite challenging if one is sympathetic to philosophical views such as naturalism, which say, look, the natural world is all there is no cosmic consciousness, there is no divine reality. So from that point of view, psychedelic therapy starts to look like it works by the induction of metaphysical hallucinations, in a term used by Owen Flanagan. And the journalist Michael Pollan, talking about the use of psychedelics in terminal patients, has said, is psychedelic therapy simply foisting a comforting delusion on the sick and dying? Now, very clearly, the worry that Michael Pollan is articulating here is precisely the trade-off view that I mentioned earlier. So the worry is that undergoing these psychedelic-induced mystical experiences might have all these pragmatic benefits of making people happier, less anxious, less afraid of death, and so on. But the concern is that those pragmatic benefits are purchased purely with epistemic costs, that from an epistemic standpoint, psychedelic experiences are all bad news. That's where the concept of epistemic innocence becomes relevant. So one way that we could respond to this concern is the way that Owen Flanagan and George Graham do, and in a paper on the idea of metaphysical hallucinations induced by psychedelics, they question the idea that epistemic evaluation should really be the main thing we're concerned about when we evaluate these states of consciousness. So their broader project is to protest the pathologization of states of consciousness on solely epistemic grounds. And so they point out that, look, there's no clear, precise, or firm link between epistemic accuracy and mental health. So epistemic accuracy is neither necessary nor sufficient for a cognition being a mentally healthy one. And on that point, they're surely correct. Nonetheless, if we think that epistemic evaluation matters, we might want a different way of responding to this concern that psychedelic therapy is foisting a comforting delusion on the sick and dying. And this is what the concept of epistemic innocence offers, right? So it suggests the idea that perhaps, as well as their very real epistemic flaws, psychedelic states might have significant epistemic benefits. And this is exactly what I've argued in a series of papers. So in my view, there are epistemic risks involved in the therapeutic use of psychedelics. It does sometimes lead to the acquisition of implausible or evidentially unsupported beliefs, but there are also significant epistemic benefits that reliably result, and these can be both direct and indirect. So on the direct front, during the psychedelic experience, people can have non-trivial psychodynamic insights into their own lives and personalities, and they can also have insights into the potential of their mind for beneficial states of consciousness and helpful ways of paying attention, parsing experience. And on the indirect front, the story is very similar to that which I told earlier about defensive delusions. Insofar as psychedelic experiences have these psychosocial benefits, reduction of psychiatric symptoms, that is very likely to lead to significant flow-on benefits in the epistemic domain as well. Because once again, psychosocial functionality and epistemic functionality in human beings are profoundly intertwined. So applying the concept of epistemic innocence to psychedelic states in this way has several payoffs. So the first and most obvious is that it helps us to better understand the complex epistemic status of a strange, controversial, but highly promising new psychiatric treatment modality. The second payoff is that it shows us that there's another way to respond to what I call the comforting delusion objection, this concern articulated by Michael Pollan, that allows us to still keep epistemic evaluation at the forefront. And third, it shows that the core idea at the heart of the Epistemic Innocence project is quite broadly applicable and goes beyond just the re-evaluation of irrational beliefs. So the Epistemic Innocence project and the monograph give us valuable conceptual tools for thinking about the complex epistemic status of cognitive states, cognitive processes, even states of consciousness that are standardly dismissed on grounds of their irrationality. Thank you.